How you doing?
I'm doing so well. Let me get tickets. I'm a little cash today. Sorry about that.
Oh, it's all good. So
Oh,
I'm always cash.
well,
So
that's true. You are. So,
yeah.
okay. Let me just print up the. All right. I got the tickets up now, too. Okay.
How's your day going? Busy? Crazy?
Well, I knew I was going to have a busy day yesterday when I saw that Dr. Lowe has a plan to issue the Section 22. So I knew my day was about to change.
So let me ask, um, how much communication goes back and forth? I mean, I'm assuming that Peel Public Health communicates with the municipalities, correct?
Yeah. Well, certainly I did get the notice.
Okay.
Not enough.
Okay. All right. Well, yeah. So let me ask you. I mean, like with Doug Ford's announcement on Friday. I mean, I say this. How bad did the team mess up?
Oh, you're going to put me in a position where you want me to comment on that?
Well, did you? Let me ask them. Let me rephrase the question then. Okay. Let me rephrase it.
I think we all came out in opposition of what had been proposed on Friday.
Yeah.
Um,
No
you know,
communication.
oh no, none.
None. Okay.
No,
Okay. So,
no, no. The fact that they were planning to give police more enforcement powers and the fact that they were going to close all recreational amenities. We knew that there would be changes, but we didn't know what they were going to be. We heard they were considering stricter measures, largely because of Dr. Lowe. I mean, he has been a hero. You know, he was the
yeah.
first one to close down schools, right? And then Toronto followed. And then we went into another 2-week lockdown. So we knew there was going to be the 6-week lockdown rather than the 4-week lockdown. We heard they were contemplating additional restrictive measures. We just didn't know what they were going to be. But honestly, with recreational activities in particular, we know that the risk of transmission is minuscule. It's very small. It's very small. And so, I mean, I will share with you that the fact that, we had to close down playgrounds during the wave one was really difficult for me as a
Yeah.
parent, as a woman, and I would be on walks, through the park or through the waterfront trail, as you know, I live close by there, and to see, the yellow tape up and that parents wanting to put the children want to be on the swing and having to explain that unfortunately we didn't understand how the virus was transmitted and there was a risk, but it was heartbreaking.
Yeah.
And now we know that the risk of transmission, on surfaces that way is minuscule, particularly outdoors. So I don't know, and I think you spoke to Dr. Lowe about this. This is not where he would have gone. We have been saying for months, you need to curb the chain of transmission. To break the chain, go to the source. And we've known for some time that the source is many of our workplaces and the households, and then
Sure.
community spread. It's sort of a vicious cycle. And we have said for a long time we needed a level playing field, which was, as they did do, they closed the non-essential aisle in the big box stores. They reduced capacity. However, we said you've got to address the workplaces. How many of those large employers should be open right now? How many of those manufacturers are really essential? We should be looking at those lists and moving them to the non-essential list rather than the essential list. Like, I can't pick something at random. Why don't you give me an example if some large manufacturing or factory should be open right now, other than food processing?
Yeah, you're right. I mean, is
You know,
Peel is Peel on its own? Like, are we like kind of
so
like
so no,
fighting
we're
for our own kind of like?
well, we are a very unique situation, as you well
Yeah.
know. Very unique here in the level of transmission. The fact that we do have large places of employment and essential workers that reside here. So we have a perfect storm. Plus, we have large extended families. There's no denying that. And the community transmission has been high. So we have a very unique situation that needs additional measures. So, we've been saying, look at the large employers, the large workplaces. So he invoked a Section 22. So if you mean, are we on our own? We are on our own. And then
Yeah.
this afternoon, Dr. Eileen Davila in Toronto, the public health officer there, who used to be ours, as you know, and Mayor Tory agreed. He's onto something, just like he was onto something when he closed schools. We've got to break the chain of transmission. What else can we be doing? So when he decided he would invoke Section 22 on any workplace that had 5 or more linked COVID outbreaks. So you need 5 cases that are connected, whether they began at the workplace or at home or in the community, but 5 of them in one site, they would have to close.
Yeah, within 10 days, I think it was.
For a 10-day period. For a 10-day period, right?
So,
and that begins on Friday, I believe. And that does give those employers a little bit of a heads up to make sure they're following all the safety protocols. So you've got labor board guidelines, and of course you've got health guidelines as well. So you've got a whole bunch of regulations they need to have in place. And that doesn't mean masks that are, you know, improper, looking for a mask, improperly worn. Here's one, improperly worn. You know, I think the light side's out. You know, this is how you wear a mask.
Well, you're going to put a mask?
Not like this, right? You know, and so let's ensure that masks are being worn, that they're properly being worn. Let's make sure people are hand washing, that there are plexiglass barriers up if that's what's necessary and needed. I feel like the light is really harsh here.
So, well, let me ask, I mean, because, so we put up articles on Mississauga in regards to the airplanes with COVID-19 cases that come in. Some of them are domestic, but a lot of them are international, and they come in like literally every week. And a lot of them are from the biggest hotspot right now, which is India, and they have like a double mutant, you know, variant. And we're still allowing these international flights to come in on a daily basis.
Well,
you know,
so,
I know this isn't your jurisdiction.
But yeah, it's not my jurisdiction. However, Canadians are permitted to return home. We do ask for that negative test. We do ask them to take a test when they arrive and send them to the quarantine hotel when they're landed. You know, I don't have the most recent stats, perhaps you do, but you have pretty much asymptomatic if you're on an airplane with COVID. And from my understanding, the older stats used to be 1 to 3%, which is extremely low, but it exists as well. Obviously it does, because we have the South African and the Brazilian and the UK variant here. Now, there shouldn't be any personal travel, but you understand that there's trade and there are essential workers and sometimes on compassionate grounds. So there is some travel that does occur. And I think we both acknowledge that.
Okay. Let's talk about, obviously, the playgrounds. They're open now, thank goodness. But also, like...
I think all the mayors were very vocal about the playgrounds in particular.
You guys are all
in particular.
But there's other, you know, there's tennis, basketball, golf, and stuff like that. Are you going to push the province to open these up?
I will share with you that the Ontario Big City Mayors had a conversation, and we did draft a press release. Mayor Lehman and I are chair and vice chair, and it was very mixed support. It was about half and half, and we decided that since it wasn't 100% or 80%, that we wouldn't ask for it as a group to reopen all recreational amenities, because there were mayors that believe, and you know, it's not the right signal to send to open things that have already been closed, and maybe this isn't the right time. But you know, if it were me or Dr. Lowe, he has himself said that the risk of transmission in outdoor recreational activities is very low. And, you know, particularly we're in our, you know, we've been locked down since November 23rd. The weather is becoming nicer, well, other than tonight, because of course it's about to snow. But, you know, people do want to be outside. It's safer for them to be outside. They need it for their mental and their physical well-being. So a golf game, if it's with your immediate family, you're sitting in a cart with your husband or wife or partner or whatever, child, safe, you know, versus many of the alternatives. Same with tennis, basketball. As long as you're not in groups, you know, you have to follow the rules as well. But, you know, certainly safer than a lot of other activities. So that was surprising. That was surprising. At least we allowed the children to play on the swings and the slides.
So I'm assuming then it'd probably be after the 6-week stay-at-home order.
They'll get lifted?
Yeah.
You know, they have now walked back a few things.
Sure. Okay.
Right, so they walk back the playgrounds, they walk back the new police authorities, and as we all heard, police were not going to use any powers to make any arbitrary or random stops at any individuals. Nobody was willing to do that. It sounded a lot like carding and profiling.
I think some
breach of your charter rights. Pardon me?
Yeah. I said, I think some heads will roll in the province.
We're hearing rumors of changes,
Yeah.
right? Rumors of changes and shuffles and things. We don't have any information, but just rumors. Rumors abound.
Let's talk. I always have to ask this because, obviously we have restaurants that follow us, and when are we realistically going to start opening? I know this is. You have the number, so okay, go ahead, please.
Yep. Very bad. Peel, 352 cases per 100,000.
Good.
Caledon, 362 cases per 100,000. Brampton, 467.
467?
466.7, so I'm calling it 467. These are daily cases on a rolling average, right? Per 100,000. Mississaugas are 275.5. But do you remember 2 months ago, they were 63 and I wanted to go to the red zone? It seems like a lifetime ago, doesn't it?
Yeah, for our viewers, some context, it has to be 40 to be in the red zone. So we're not even in the same
2 months ago, we were in 63 and I was arguing red zone. Today we're 275 in Mississauga. You know what's very, very high though is the positivity rates are very high again. Mississaugas are 14.5, Caledons are 13, Bramptons are 22. 22%. 22% positivity.
Up 2% from last week.
And the R factors, the reproductive rate, all over 1. All of them. All of them. Ours are the worst, actually. 1.12, Brampton's 1.10, and Caledon's are 1.06. And we do have the numbers on the new variants, and they're quite high as well. Particularly the variant B117, which is the one that originated in the UK. Very high. We do have cases of B1351, which is the South African, not too many though, only 18 overall in Peel, and not too many of the Brazilian, the P1, only 52. But nonetheless, they seem contained, but we know they're virulent, we know they're severe, and we know the impact, we know they're also affecting younger people. And so that's why we continue to say, when your number is called, please go get vaccinated. We are now at, what are we at? 50 plus in hot zones. I think going down to, AstraZeneca has just been announced for 40 plus, but that's only, 40 plus, but that's in pharmacies and in primary care.
I'm getting my shot in 2 hours. Yep. Team AstraZeneca, man. It's the comments that I see about AstraZeneca, man, they're not good. It's like they've been kind of brainwashed to think that it's bad for you. But anyways, I mean, I'm probably going to get hate for that comment, but it's true. But
well, we always will, because there will be an element that are opposed to any sort of vaccination, no matter what they are. But we have to remember that less than 1% of the population will be affected no matter what the vaccine is. And let's remember that we eliminated smallpox and polio and measles and mumps and rubella and SARS, and what else did I forget? Because of vaccinations.
Yeah, I agree. I had Dr. Lowe on before you.
Oh, did you? Good.
Yeah, he said that you have a better chance of getting a blood clot flying to Vancouver than you do, getting a vaccine.
There were 5 cases out of, over 10 million.
Yeah, so I guess let's talk about the AstraZeneca vaccine since we're talking about it. Peel is obviously a big hotspot. Would you be okay with, or would you be pushing to get AstraZeneca for the 18 plus?
Absolutely. I wish we had enough so we could do that. It's 18 plus now only in hotspot zones, right? If you can find a pop-up or a mobile clinic. We don't have the vaccine supply to allow us to do that. Other than in the BAPS Mundir, right? They have a pop-up there for 3 or 4 weeks, but you can't get an appointment unless they open up more appointments. They're all full. Yeah. They're all full. And we can vaccinate 13,000 per day. If we had more vaccine, we could vaccinate 20,000 per day, by the way, in our mass vaccination sites. So
Okay.
give us the supply and give us the vaccine, and we'll get them done.
And
It's
then
much
right
more
now,
efficient to do them there, right? But I understand how employers and, you know, we would like to get the pop-up and mobile clinics up to, you know, especially those large employers who are interested, or to those high-risk marginalized groups. Absolutely. And if we could do them in mosques and gurdwaras and mandirs, great. But it's all a question of supply.
yeah, Dr. Lowe said end of the month, 18 plus mobile
That,
vaccination credits. So
that's
let's.
not, so what are we today? This is the
We're
20th. I know,
yeah.
I know that because my son's birthday's tomorrow, his best friend's today.
Okay.
So
Okay. So we did put out a poll on our Instagram stories and asked if 18 plus would take the shot, and 55% said no. It's crazy, but anyways,
did you give them a list of reasons why?
no, we just asked because I think Stephen Del Duca, the Ontario Liberal Party
Liberal
yeah,
leader. Mm-hmm.
yeah, he did ask to get 18 plus vaccinated by Astrazeneca, and we just put up a poll, and 55% said no, and about 3,000 people voted. So, anyways,
That's a lot.
it's mind-boggling why people have been.
But that still would vaccinate about 1,300 people then.
Yeah. So okay, let's move on. Tickets. Did the city give out any tickets?
Yeah, that's why I pulled that up, and then it just turned off. Hang on. Oh yes, we did. And well, we already know what happened at the gym, so we don't want to talk about that.
Yes. Well, can we talk about that?
Yeah, we sure can.
Yeah.
4 Part 3 charges and 2 more Part 1 charges, right?
And this is the Huff Gym boxing gym, correct?
Yes.
Oh, sorry, I said the name.
Right, I wasn't going to, but you did.
Oh, so everybody knows.
Everybody knows. And the court will assign the penalty, the financial penalty. But I mean, they do risk a $500,000 fine. They do risk that.
Okay.
And they are not shuttered. They continue to open.
Oh, they're still open?
They continue to open. And every time they do, we go over and find them again. We have no ability to chain or bolt their door, but they will be fined. I assume that they'll be dealt with in the courts. Oh,
sorry, but then doesn't the Section 22 order kind of allow Peel Public Health to close that, or is that?
Well, how do you do that physically? I mean, we had Peel Police assisting our bylaw enforcement over there.
Interesting. Okay. So let's talk about other tickets.
Yes. Okay. Monday, there was a jewelry store for in-store shopping.
Okay.
Tuesday, there was a pool construction business opening. Wednesday, there was grocery store, a number of tickets for not wearing masks, grocery supermarket. I think these were smaller grocery supermarkets, maybe ethnically based. There was the fitness. Okay, the Wednesday was the first Part 3 summons at that gym that you mentioned. On Thursday, there were 2 more tickets. I think they were the Part 1, not Part 3s. A nail salon was open. They were charged. Not the same fitness facility. Patrons protesting outside. 3 Part 3 summons.
Okay.
Hang on. On Saturday evening, there were private gatherings at a private residence, social gatherings at a private residence, 2 of them, 2 different ones, I mean.
Yeah.
And so that would have been called in as a complaint, right? We're not proactive. We operate on a complaint basis. So if you have a lot of music and a lot of cars, your neighbors are going to say, what's going on over there? This shouldn't be happening. We're in a lockdown. We have to take these rules seriously. They call bylaw, they call 311, and we come out. Sunday, there was a gathering of 15 people that was ticketed. And then there were just some security highlights with respect to, you know, how we prefer to educate first. So in parks with people playing sports, hey, that's not permitted anymore. And that seems to be just different parks mentioned. We have park ambassadors going around to the parks and just saying, look, unfortunately, the new rules are in place, and unfortunately, you can't play those sports just now, hopefully in a couple of weeks. and they dispersed. So there are no tickets because they were cooperative and they dispersed.
Okay. Do you mind if we jump back to vaccines?
Sure.
Okay. The province pledged 25% more vaccines to hotspot areas. What are your thoughts on that? And I guess when should we expect them? Or is it?
This was a question you should have asked Dr. Lowe. From my understanding, we are receiving 100,000 doses a week.
Okay. Okay.
So that's great. That's really great news. And should have happened from the beginning? Absolutely. You and I both know we cannot control this virus, the spread of the virus, unless we control the hotspots first. So we are actually holding back the rest of the province. And we're obviously the ones driving them being in the lockdown as well, the stay home order. So until we deal with it in the hotspots, notwithstanding on an ethical basis, everyone wants their share, but let's be honest. You know, when your house is on fire, we've been described as the inferno. You've got to deal with the source first before you start watering the houses around us, or the neighborhoods around us. So that should have happened from the beginning. And we know that in the beginning, we were not receiving even the provincial average. So I think somebody messed up.
Yeah, I'm going to say that too. Yeah. So, do you plan to follow Toronto's lead in regards to kind of the cherry blossoms in regards to Korea Park?
So we do have
No.
No, we do have the webcam open, but as long as, you know, people don't overcrowd the space, we'll probably have some park ambassadors there managing crowds. I talked about a registration system, but I don't think they feel that's necessary. I want people to enjoy them, but let's do it safely and let's be sure that there are not a lot of crowds there. But there is a webcam as well. So you can go on the webcam and enjoy them. No, it's High Park, right? So I know that it tracks thousands and thousands of people. It's bigger.
Yeah. So, okay, let's get to some viewer questions here. Has there many tickets issued to construction sites?
I'm only laughing because
What?
Not in Mississauga is the answer that I've seen recently. I think early on we had a few minor outbreaks, but that's dealt with at the site and with the employer.
Sorry, why'd you laugh?
Well, I understand there was a workplace shutdown last week, but not in our municipality.
Oh, okay. Well, will River Grove Community Center be used for a mobile vaccination center?
It's not currently the plan. The mobiles are largely in cultural places and workplaces. And, you know, we just don't have the supply of vaccine to do that. So we do have the 5 sites right now in Mississauga. The International Center, the Paramount Centers are the largest ones. We have a 5120 here, Ontario, at Derry, just north of Derry. And we have, now that I've said that, UTM and the hospitals. Right? So those are our 5 sites. 2 of them are hospital sites.
Cool. And I know this is more of a Dr. Lowe question, and they're probably just figuring it out now. What types of projects constitute essential to non-essential construction?
I think non-essential construction is something like a home renovation that hasn't started yet. A lot of construction is essential, so that really hasn't been defined yet. I did notice, I did write down what he said were essential, that were exempt. And they were healthcare related, first responders, emergency childcare, etc. So that sort of thing that is really essential, whereas so they can contain it and remove those individuals and have them isolate without having to shut down the whole, you know, paramedic station. Maybe that station, that shift, but not the whole station, because obviously it's essential, providing an essential service.
Okay. And when will transit operators be vaccinated?
Oh gosh, you know, I've been advocating for transit drivers, ATU, for educators, transit drivers. I've used them in the same sentence. Of course, I think they should be. It has been question of supply, and the priority has been by age cohort, age category, right? So we did the 80 plus, then 70, 60. We're now at 50, and 40 plus if you're AstraZeneca, right?
Okay, and one last viewer question here. Who is your favorite child? Your daughter seems great.
Did she send that to you? Oh goodness. Well,
I'm not going to confirm or deny that.
so tomorrow's my son Alex's birthday. So today we'll say happy birthday, Alex. Love, mommy. Come over for dinner. Come home early for dinner, I should say. And we'll have a nice dinner for your birthday, and maybe I'll make something special.
Okay, awesome, cool. I'm done with my question, done with the viewers' questions. Anything you'd like to add or say?
I don't think so. I mean, I'm very, let me just say that I am very proud of Dr. Lowe, because he's now twice come out on his own, doing the right thing to stabilize Peel. You know, we need additional measures in place here, because what has been working has not been working. And we've known that. And we've been saying that for some time. We need to do something different, because it's not working here. We have not broken the chain of transmission. So I'm very grateful to him to try something different. And whether it's shutting down workplaces, I've been advocating for putting more of those large employers. Let's look at them more closely. Are they really essential? Put them in the non-essential list bucket, at least for the lockdown, at least for the stay home order. You know, let's close them for 4 weeks and see if it makes a difference. So this is the right thing to do for Peel. It's the right thing to do for Mississauga. And I did hear the argument that, you know, 5 employees out of 10 is 50%, and of course they should close, but 5 employees out of 400 is minuscule. Nonetheless, it's symptomatic of a bigger problem. Right? So let's walk through our protocols. Let's make sure everything is in place to protect all of those workers. And let's not forget that we've also been advocating for sick pay benefits and sick leave, because what exists currently is not sufficient. It's cumbersome. They have to apply for it. You don't get it if you're only waiting for a test result, right? And it should be seamless to people. And it is less, it's minimum wage, and many of them make much more than minimum wage. And as you recall, we did research which proved, we looked at 8,000 people who worked in essential workplaces, largely in our factories and warehouses, etc. And we looked at 8,000 people who were symptomatic. 1 in 4 continue to go to work. 1 in 4, 25%.
Yeah,
2,000 people continue to go to work sick. Let's start there. And another 80, after they received a positive test, continue to go to work. So it just tells you people need the paycheck. So the only way we're going to get them to stay home and safely recover is we ensure that they are getting their wages. Their wages are paid. And I don't know how you do it. You top up the benefit, whether it be CRB, CRSB, EI. And this is also a question for these workplaces that could potentially be shut down by Dr. Lowe.
True.
Because those sick workers will receive the Canadian response sick benefit, right? Canadian Recovery Sick Benefit, CRSB, or the CERB or EI, but what about the rest of them? But I think that because they were told they had to close, they will all be eligible. But we know that it's cumbersome to apply. Nobody wants to apply for benefits when they're sick. The employer should just continue the wages, right? And the federal government can backstop that pay. So I'm very hopeful that this is still being considered and it's still on the books. Amazon did the right thing when Dr. Lowe closed down Amazon. They continue to pay their workers.
They did. Okay.
Mm-hmm. Yeah.
So okay.
They provided sick pay for everyone, because not everyone was ill, right?
Well, I hear they're at least talking about it now, which is more than what they did last week. So yeah.
Correct.
So,
I think there's been a little bit of pressure.
Yeah. Well, thank you so much, Mayor Crombie. Once again, it is 5.
Yes.
Have a good night.
Thanks very much. Good night. Bye-bye.
No, sorry, an hour. So take care.
Good luck.
Thanks.